Good afternoon. Thank you for being with us for this part of our Wolverine Caucus series. The University of Michigan is pleased to put on these forums each month. It's an opportunity for the University of Michigan, the Michigan Alumni Association, and those of you who are alumni of the University of Michigan who work in and around state government to have an opportunity to enjoy hearing faculty from the University of Michigan, such as our wonderful speaker today, Dr. Julie Lumeng. And it gives us a chance to see how serendipitous we can be about topics that are currently in the news. And we couldn't have planned this one any better. Today, the New York Times talked about childhood obesity. Today, we know that many in state government are working on initiatives. This week, we'll hear more about that, probably from Governor Snyder, who has this at one of the highest points on his dashboard. We know that President and First Lady Obama have worked on this initiative nationally. It is a concern. And so we're happy today that those of you who have joined us are here. We're happy to see State Representative Joan Bauer and Nancy Short from Governor Snyder's office. And also, we are very pleased to have State Representative Andrew Kandrevas, an alum of the University of Michigan, who will introduce our speaker today, Representative Kandrevas from the 13th District, the great city of Southgate. Please join us today. Thank you for being here.
Thank you very much. Good afternoon, everybody, and a great big Go Blue. It's a really great week to have a Wolverine Caucus, I think, and maybe not everybody's a football fan, but there's a lot of school spirit, and this is a great series that we have, the Wolverine Caucus. It's an honor for me today to introduce today's speaker, and I also will add that I'm class of '97 at LSNA, so I always have a lot on the line, working up here in Lansing and being in Lansing, especially in a couple of weeks. So without further ado, we have a lot to talk about today. The University of Michigan physician and professor Julie Lumeng is co-director of the Centers for Comprehensive Prevention of Obesity in Childhood, which tests interventions and policies to prevent obesity and reduce chronic disease risks. In addition, Dr. Lumeng is assistant professor in the Department of Pediatrics and Communicable Diseases, as well as clinical instructor of pediatrics and assistant research scientist at the Center for Human Growth and Development. Recently, the U.S. Department of Agriculture's National Institute of Food and Agriculture awarded Dr. Lumeng and her research team with funds to reduce the prevalence of childhood obesity among Head Start preschoolers here in Michigan. Dr. Lumeng received an MD from the University of Michigan. She completed a fellowship in behavioral developmental pediatrics at Boston University School of Medicine and is a fellow of the American Academy of Pediatrics. So without further ado, we would love to hear from you, Dr. Lumeng.
Well, thank you so much for having me today. What I'll do in the next half an hour is review the state of the obesity epidemic with a focus on the state of Michigan, and then talk about some of the research projects that we have going on right now to try to think of a novel, new way to address childhood obesity. Because I'll just preface by saying that often when I go to, like a social gathering or a party or something like that, and someone says to me, "So what do you do for a living?" And I say, "Well, I'm a pediatrician, I see kids, but I do research and it's focused on childhood obesity." And sometimes people look at me and they say, "Well, that's simple, you just eat less and exercise more." And I always say, and I think many in the room agree, that if it were that simple, no one would be obese or overweight. And so what I think we've all had the experience that doing initiatives that simply tell parents of young children, just have your child get more exercise, eat more fruits and vegetables, and eat healthier, that those sort of educational interventions have been going on for quite a long while and just don't seem to be making a big difference. One of the sort of things people chuckle about is that the US government has been putting out public health messages since the 1970s, telling adults to exercise more, eat healthier, et cetera, and the prevalence of obesity has only increased. So education alone of telling people what they need to do is just not doing the trick. So what we're trying to do is think a little bit more creatively about how could we address this in a new and different way, which is what you'll hear me talk about. I also want to emphasize, am I up here pitching that what I'm proposing is going to solve the childhood obesity epidemic? No. I mean, this is a really complicated picture. There are multiple different pieces of this pie, and what I'm describing to you is one possible angle. And again, I want to emphasize it is research. We're trying to understand what works. And so when the USDA gave us funding to do this project, it was with the specific goal of, please test this intervention and see if it works. And if it works, then we can roll it out around the state and maybe around the nation. But right now, we just started this week. We're going to test and see if things work. So without further ado, I'm going to start off by going through some slides some of you may have seen. So what you're seeing is this is a map directly from the CDC showing the prevalence of obesity across states going back in 1985. And what I'm going to do is go through these slides going from 1985 all the way up to 2008. And what you'll see is the colors of the states changing to demonstrate the increasing prevalence of obesity in the nation over those 20 years. So what you're seeing here is that back in 1985, all the white states were not even keeping any data. They weren't even tracking this. Light blue states, the prevalence of obesity, believe it or not, was less than 10%. And there were some states in which it was 10 to 14%. You can see back in 1985, Michigan was not even keeping data. Okay, let's see if I tap this, what happens. Great, thank you. Okay, so here's 1986. You can see there's a little bit of an uptake, some more blue on the map. 1987, the blue is increasing. 1988, it's increasing. 1989, 1990. 1991, we had to add an additional category of 15 to 19% of adults obese. 1992, 93, 94, 95, 96, 97, we had to add an additional category of more than 20%. 98, 99, 2000, 2001, 2002, you can see there are more categories of greater than 25%. 2003, 2004, 2005 had to add another category of greater than 30%. 2006, 2007, 2008, 2009, 2010, I believe that's the last one. So I think this map, which you can, it's on the web, on the CDC website, it really emphasizes something has changed very dramatically. And I think that sometimes I'm speaking with undergraduate students, so 18-year-olds at the University of Michigan, and it occurs to me that these students probably don't remember a time when the majority of people were overweight or obese in their midst. So this is the increase in adult obesity prevalence in Michigan. It's 2004 to 2008, and again, it's a similar pattern that the lighter colors mean a lower prevalence of obesity. The darker colors mean a higher prevalence. Just in those 4 years, there was a significant increase in the proportion of adults, the counties in which more than 29.8% of the adults were obese. So now I'm going to focus a little bit on children. Those slides were about adults. When you look at children, what you see is this is the prevalence of obesity in kids. Back in 1963 to 1970, just 5% of children were obese. And some of us, I think, looking back to grade school, do you remember in grade school maybe there was one child in the class who was heavy, right? People are nodding. And now you go to classrooms and I think the frame of reference has shifted because so many children are overweight. There's not just one child in the class anymore. So you can see things are pretty stable, 70s or into the late 70s, early 80s. Then you begin to see an uptick in 1988 to 94. And then in 99 to 2002, you see 16% of children are obese. The most recent data shows 17% of children are obese. What my research focuses on is the differences based on socioeconomic status and why low-income children are more likely to be obese. And I'm going to put forth a few ideas about why that may be true. But this illustrates, I think, very clearly why we're so interested and focused, particularly on low-income children. So what this is showing you is the change in the prevalence of obesity over a 10-year period. This was, from 1986 to 1998. So you can see this red line is upper income white girls. What's interesting is that during that 10-year period, there was hardly any increase at all in the prevalence among upper income white girls. This blue line is low income African American and Hispanic boys. Look at that dramatic increase from about 6% up to about 28%. It more than quadrupled in a 10-year period. People are really trying to understand why that would be true. This is the prevalence of obesity in children in Head Start compared to the general population. So everyone in this room, I'm sure, knows that Head Start is preschool for low-income children, true in every state in the nation. This particular diagram is from Texas. But in my experience working in Michigan, this pattern is the same. What you see here is that the front bars this is the prevalence of obesity based on national data in all children, regardless of socioeconomic status, so regardless of income. This is the prevalence of obesity in children enrolled in Head Start or social programs for which you have to have an income below the federal poverty line. So what you see is it's significantly higher. And this is in all groups: white boys, white girls, black boys, black girls, Hispanic boys, Hispanic girls. True in every group. It's telling us it's about income, something about income. This is the prevalence of obesity among low-income 3 to 4-year-old children. What we're emphasizing here is that children have really already become obese in low-income groups, often by age 3. So I'll get to this in a minute, but the work that we're doing in Head Start, in these Head Start populations in Michigan that we're working with, 40% of the children are overweight already by age 3, and 17% are obese by age 3. And so what we're trying to do in our work is go younger and younger, because the horse is sort of already out of the gate, right? Once you become overweight or obese, I think, as a lot of adults in this room who may have struggled with weight, I myself included, once you develop overweight or obesity, it is much harder to lose that weight and maintain a lower weight than it would have been to have prevented the obesity to begin with. So our big focus in these kids is, can we prevent that transition into obesity really, really young? And we're seeing that transition into obesity is happening younger and younger in 1- and 2-year-olds. And so that's where some of our work is focusing, trying to understand that. So how many children are poor? Why does our work focus on low income and poor children? 1 in 3 Americans are low income. 12% of Americans are poor. 43% of preschool-aged U.S. children are low income. And just to reflect on that for a minute, sometimes that surprises people. And the fact of the matter is, though, that families, when they're young and the parents have not yet gotten through college and they've had their children young, families' incomes increase as the children grow older. But when the children in the family are young, 43% of all preschool-age children in the U.S. are low income. 21% of preschool-age children are poor, meaning an income below 100% of the federal poverty line. Michigan ranked 30th among states for overall child well-being, 30th out of 50th, with number 1 being the best. And between 2000 and 2009, the Michigan child poverty rate increased from 14% to 23%. So I think this is a particular problem for Michigan, low-income children. So what causes childhood obesity? And again, I gave you the anecdote of what happens to me at parties. and then I say, well, I think it's a little bit more complicated than just eating less and exercising more, because we would all be doing that if it were that easy. So let's, before I go on to the next slide, about 10 years ago, when I first became interested in the issue of childhood obesity, I was working in a low-income clinic in Boston where I was seeing a lot of school-age children who were living in very stressed home environments. And what I would often see as I was following them over time is that the children would first present with behavior problems, meaning their parent would be saying, my child's crying a lot, my child is getting angry easily, my child is acting out a lot. And then I would watch, and in the next year, that child's weight status would tick up, 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 up. And there seemed to be a relationship between the child's behavior problems, their difficulty regulating their emotions and their behavior, and this increased risk of obesity. And so it led me to begin to question whether or not children who are having trouble regulating their emotions could be at higher risk to become overweight or obese, and if that's a point for intervention. And I'll play that out in the next 20 minutes. So when I published that study hit the media, and I was a quite junior faculty member at that time. It hit the media. I was rather surprised by how much it hit. It was in the New York Times. It was in international media. And I was interviewed by one particular reporter who really was trying to convince me that, oh, no, really it's all just about bad parents. The parents are bad parenting. If you've got a bad parent, your child has behavior problems and they have obesity. It's all about these bad parents. So I said, I really kind of disagree. I think it's a lot more complicated than that. And then we sort of ended the interview. And the next day in the paper, there was an article. And the quote from the article is this. I've long suspected that rapidly growing rates of childhood obesity in the U.S. may be tied, at least in part, to the